Hi, this is Dr. Dumestre, board certified plastic surgeon, and I'm going to start a new series discussing DIEP flap reconstruction after breast cancer. So in this photo, you can see here, I'm up by the microscope. My colleague, Dr. Honore, is down at the belly, and our two assistants are helping out, getting things sorted. Now, what is a DIEP flap? That is basically when we use the tummy fat that is typically removed during a tummy tuck to recreate the breast after they've been removed through mastectomy for breast cancer. Now, when we move large pieces of tissue, say muscle, bone, or in this case, fat, they need to have a life source. So this is actually done like a same person transplant where that fatty belly tissue is actually harvested with an artery and a vein that ultimately feeds and drains it of blood. Now, when I move that tissue up to the breast, it has the artery and the vein attached, but it doesn't actually have any flow to it. So what happens is under your rib, you have an artery and a vein, the internal mammary artery and vein, and these are exposed. And basically we use a microscope to hook up these small 1 to 2 millimeter vessels using extreme magnification and a very, very thin stitch. This stitch is so fine, it's finer than a piece of your hair. And so all of this is done with like very fine microscope instrument handling. You can see here, the two artery ends are now brought together from the chest and to the belly. Here is a view of another view of where we're at during the surgery. So in this case, I am working on the belly and I'm using loop magnification. So it's still making everything bigger so I can see those vessels, but still not as big as the microscope. And I am tracing the artery and the vein that feeds that piece of fatty tissue through and under your ab muscle. Now, this is a very muscle sparing approach, so it doesn't tend to result in any abdominal weakness. And then my colleague, Dr. Honore, there is up top. She's removing a little piece of rib for me, getting that artery and vein ready so that I can get back under the scope. Here we are, that last stitch is now being thrown. Those two artery ends are now hooked up. I've already hooked up the vein. The vein is actually done not through stitches, but through a device called a coupler, which is a plastic device that has these little spears and brings the vein ends together. The artery has a thicker wall, so it can't be, you can't use the same device for that. Then once we're all done, the artery is temporarily clamped off from the chest because it has a lot of power through the internal mammary arteries. This allows me a bloodless field to fix it. And then I'm going to come in and remove that clamp. And then all of a sudden, we're going to see some bounding blood flow that goes through the anastomosis, giving it its life source. So here we come in with the clamp that is removed. That is now micro over. We call end ischemia. So this flap is no longer dead. It now has beautiful life. You can see the vein right next to it. And again, back to the starting shot where we're all positioned for this great surgery.